Hello, welcome to My Body, My Rules. I'm Dr. Gudrun Welder, this is Dr. Darren, and we're from My Chiropractic. And today we want to talk to you about chasing symptoms. At our clinic, we do not chase symptoms, and what we mean by that is if the body is experiencing a symptom, it's actually a language of the body trying to tell you that something is wrong. But sometimes that symptom can be primary, where it's actually coming from where the condition has started, but it can also be a symptom from somewhere else in the body, or a bigger picture sort of thing. So to give you an example from my practice, what I deal with a lot is people coming into me who see a specific microbe as some evil thing that they need to get rid of. Say if it's candida, or somebody did a stool test and found a certain parasite that they have. There's some really common ones out there. Or maybe even just certain viruses that are recurring, like upper respiratory tract infections. What I like to do, instead of making that one virus or microbe the bad guy, I want to look at the big picture as to why is your immune system reacting the way it is to these microbes, because they're everywhere within us, and if there's something that is overgrowing in your system, we need to look at why your system is allowing that to happen. What about you, Dr. D? What kind of cases do you see like this?
Well, with regards to symptoms, like you said, it's the body's communication to the outside world that something's going wrong. Symptoms can be local, right? So somebody, or you bang your hand and our hand is sore, it's local, it's a direct trauma, it's local, you know where the symptom's coming from. Sometimes symptoms are coming from another part of the body, or referred pain. So sometimes people that have gallbladder issues can present with right shoulder problems. Somebody that has a pinched nerve, as an example, like sciatica, they can have pain that goes all the way down their leg, right down to their foot. So treating the foot isn't going to solve the problem. Treating the low back is actually going to be the source of the problem. So I think what's important when you are dealing with symptoms, that you find a health practitioner that looks for the source of the problem, instead of just prescribing maybe an anti-inflammatory or a pain killer or a muscle relaxant. That you actually look to the source of the problem, sort that out, solve the issue, and then those symptoms go away. And I think it's also maybe important that the patient doesn't get alarmed that when we're dealing with a certain problem, that we may not be treating the direct area, right? So sometimes we've had people come in and say, well, I have this problem in my knee, it's osteoarthritis of the knee on the inner aspect, and then we talk to them about proper biomechanics and how orthotics, custom-made orthotics, can actually balance out the biomechanics and take the pressure off the knee joint to help improve its longevity.
And the danger of if you're just treating the symptoms is oftentimes when you sort of cover up the symptom with, say, an anti-inflammatory or something like that, and you don't know what its source is, then oftentimes further symptoms are going to pop up, or even maybe that anti-inflammatory is going to change different biochemical processes in the body, and it's going to create more symptoms. So you want to...
And I think you see that with chronic pain management, and the whole issue right now with opiates. You're creating an addiction pattern and a complete change in pain thresholds that are really affecting the body in a negative manner.
And I see that all the time with allergy meds, where patients come in and they're on Reactin or whatever antihistamine they're taking, and they've become addicted to it, to the point where it's affecting their system, where they're sleepy, or their nervous system has become oversensitized. Then they try to go off of it, and there's a rebound effect where now their whole system just blows up as soon as they try to go off of it. So
absolutely. So really the key is to not chase the symptoms, to get a proper diagnosis. Make sure that you are going to the source of the problem, which involves the practitioner taking time to spend time with you. It's really hard to go through this properly. If you go to a healthcare practitioner, they only want to deal with one symptom at a time per visit. Any complicated conditions or cases just won't be solved that way. So make sure you don't chase symptoms, get a proper diagnosis, follow a treatment plan, and then you'll get better.
Yeah, find a practitioner
Yeah.
who can see the big picture and explain to you what's actually going on and how it's going to be treated.
That's right. Take care. My body, my rules.